Hi, Dr. Sasse here from the Continence Center at Sasse Surgical. I'm just going to talk a little bit about the glamorous topic of hemorrhoids and how that might contribute to the loss of bowel control. And it's something that a lot of times colorectal surgeons may not address directly, perhaps not asking the questions sometimes. But there are a significant number of people who start to experience some loss of bowel control, and it can just occur with a little bit of seepage, or it can be gas that's escaping, or it can be a frank accident, all of which are no fun and are vexing, annoying problems. And then when we look on exam, we sometimes find that there are large hemorrhoids, and these can start as internal, but then they can progress and bulge to external hemorrhoids. So the question is, can those be contributing to the loss of bowel control? And the answer is yes. While we normally think of the loss of bowel control as occurring because of the loss of some of the sphincter muscle action and really that combination of nerve and muscle interaction, it's also true that sometimes if the hemorrhoids are bulging out through the anal canal, that the control of the bowels, just kind of getting that door completely closed shut, that whole function can be impaired. So what's the best approach for the problem? Well, the first step is, of course, to find a really good colorectal surgeon who has good experience in both the usual run-of-the-mill hemorrhoids, but also knows something about bowel control and pelvic floor disorders. And then get an opinion about whether or not the hemorrhoids are causing trouble and whether or not the bowel control problem could be related to the hemorrhoids. Oftentimes what we start with is an assessment of what the person's symptoms really are. Is it more the annoying hemorrhoids? Is it pain, swelling, and bleeding from hemorrhoids protruding? Or is really the worst symptom the bowel control, the leakage problem? And then based upon that, we try to help and make those symptoms better. So sometimes the symptoms have more to do with leakage and bowel control, but we find large hemorrhoids. And the best response usually is to remove those big hemorrhoids first and let the person get all healed up and then see where we stand. Oftentimes 3 months or 6 months later, the bowel control is much improved because of the removal of the hemorrhoids. But in many cases, we're now dealing with the dysfunction of the neuromuscular components related to the sphincters in the pelvic floor. And then we address that. As you probably know from seeing other videos that we talk about at the Continence Center here in Nevada, we're very much fans of sacral neuromodulation for resolving that bowel and bladder control problem that results from the deterioration of the neuromuscular function. So this kind of simple little pacemaker, it's almost like a TENS unit, this gentle current that can be sent down to the pelvic floor plexus, restores that bowel control in a huge percentage of people, over 90% of people. I hope that's given you some sense of the framework. Sometimes these symptoms can be overlapping and these conditions can be overlapping. But if you are having some leakage or seepage and you sense that you also have some hemorrhoids, it may in fact be the case that they are contributing to one another, and you need a really good colorectal surgeon to help sort that out for you. But you should have confidence that there really is a solution and that you should be able to get rid of both problems and move forward without having those darn symptoms. All right, I hope that's been helpful and I wish you the best of luck.